Hello. Okay. So I am going to start studying with the eyes and ears. I need to do something talking aloud. I don't know, but this is incredibly boring to me and I'm having a difficult time staying focused. So we'll start with chapter 26. Might as well go through the whole entire thing. We're going to jump over to 27 and hopefully I'll get done before it's time for me to go to bed. That is the desire anyway. Alrighty. So I guess I will deal with the questions at the end of the chapter like I did last time and do the objective questions and go through the chapter. Alrighty. Well, I guess I should, pull up the answers so I can actually make sure if I get the right answer, I know why it's the right answer, and same if it's the wrong answer. Evolve changed up their website. How interesting. Well, I guess I'm not doing that because I have haha. Okay, got the answers. Okay, question number 1. When a patient is receiving Lasix for a problem with edema, which assessment relative to this drug is important to the patient's health? A. Measuring the blood pressure. 2. Determine if the patient is nauseated. 3. Inquire about constipation. 4. Check for hearing loss. Well, it's Lasix, and I'm going to go with 2. Determine if the patient is nauseated. Oh, I feel like an idiot. I was thinking it was a laser surgery. Well, Lasix, furosemide. It's a diuretic, so you're looking for hearing loss because it's an ototoxic drug. Okay. Number 2. When administering eardrops to an adult, the nurse would A. Draw the pinna upward and toward the front of the head. B. Draw the pinna upward and toward the back of the head. C. Pull the pinna downward and toward the front of the head. Or D. Pull the pinna downward and toward the back of the head. You would up and back. So B. Pull the pinna upward and towards the back of the head. And the rationale is that by pulling it up and back, it straightens the ear canal, on the adult, allowing the drops to coat the whole canal and reach the eardrum. Alrighty. Number 3. When communicating with the hearing impaired patient, the nurse should select all that apply. A. Sit at eye level facing the patient. B. Use a slightly higher tone than usual. C. Enunciate clearly. D. Speak directly into the patient's ear. Or E. Use simple, short sentences. A, B, and E. Not B? Oh no, C. I meant C. Yeah, you want to sit at eye level, enunciate, and speak in short sentences. Alrighty. Number 4. The nurse evaluates the visual acuity of the I can't pronounce that word, of the patient using the Snellen chart. Which statement is true regarding the use of the Snellen chart? The chart is placed 40 feet away from the patient. The patient reads the letters using one eye at a time. The numerator indicates the smallest line and that the patient could read. The denominator refers to the patient's distance from the chart. It's either C or D. Numerator. Is that the smallest? Oh, apparently, it's B. The patient reads the letter using one eye at a time. Okay. 5. While looking at a card with a geometric grid of identical squares, the patient is asked to focus on a central dot and to describe any distortions of the surrounding boxes. Which patient statement indicates a need for further diagnostic testing? I get dizzy staring at these boxes for so long. I am beginning to see color differences in the squares. I can see all the boxes surrounding the dot. There are wavy lines around the central dot. Wavy lines, maybe? Yes, that is right. Seeing wavy lines on the Amsler grid is an indication that the patient has a macular problem. Further evaluations by an ophthalmologist should be sought quickly. 6. During a physician visit, a 65-year-old man complains of pain in his right eye associated with excessive tearing. The nurse notes that the eye is red with lashes rubbing against the cornea. A likely condition would be ptosis, ectropion, hordelum, entropion. Yeah, I don't know these words. Ectro or intro, because it's not ptosis and it's not hordelum. I'm going to go with intro. And that is right. When the eyelid is inverted and the lashes rub on the eyeball, it's called entropin. Okay. Number 7. The nurse applies a vibrating tuning fork to the middle of the patient's forehead. The patient reports hearing the sound in the middle of the head. The patient's response indicates sensorineural hearing loss, conductive hearing loss, normal hearing, or inconclusive findings. That's normal hearing. And, yep, this is the Weber's test, and hearing the sound in the middle of the head is normal. The nurse observes another nurse administering eye ointment, which action indicates a need for further instruction about technique. The nurse administering the ointment places the cap from the tube upside down on the table after removal, applies the ointment to the lower part of the eyeball, twists the tube slightly to end the ribbon of ointment, closes the eye, and has the patient move the eyes side to side to distribute the medication. It's going to be B. because you would not apply it to the eyelid. You would apply it to the eyelid, not eyeball. Yep. The ointment should be placed in the conjunctival sac, not directly on the eyeball. No. While ambulating, the patient with Meniere's disease complains of dizziness and vertigo. An immediate nursing action would be to provide oxygen, assist patient to supine position, administer nausea medication, and notify the physician. Well, your immediate action is going to have them, sit. Yeah. And the reason why is that although you would want to administer nausea medication, your first concern is safety. And because they're dizzy, they may fall. Yeah, safety concerns agree that having the patient lie down to prevent a fall or injury from bumping into things takes priority. The patient might only be dizzy, not nauseated. Alrighty, number 10. Which nursing actions demonstrates appropriate care of a visually impaired patient? Appropriate care. And it's a select all that apply. Introduce self before touching. Speak slowly with a loud voice. Keep the door ajar. Ensure ready access to the call button for assistance. Assist with feeding using the clock method. Introduce yourself. Access to the call button and using the clock method. Yeah. And the rationale is to avoid startling the person. You should introduce yourself before touching him or her. The call button should be positioned so the patient knows where it is and where it can be quickly reached. Describing foods on the plate by where they would be positioned on a clock face helps the person eat independently. And that covers the questions for 26 for me, or 25 if you have the new book. Close. What do I want to cover next? Okay, your eyeball has 3 layers. The inner layer is the retina, the middle layer is the choroid, and the outer layer is the sclera. Your macula is at the back end near the optic nerve. Your optic disc is right before your optic nerve. Looking at somebody's eye going in, the important structures to know is it goes cornea, anterior chamber, which holds your aqueous humor, to pupil. Along with the pupil, you got your irises, and then that's on top of your lens, and then the lens connects to the vitreous body and your retina, which is all the parts that help you see. Okay, well, that covers that. And in general, your eyeball is a sphere, like a basketball or a baseball. The most common causes of eye disorders are from diabetes and hypertension. And the reason why is they both deal with your blood vessels. Hypertension is prolonged, untreated hypertension. You got that consistent hard thumping that will quickly thin out already tiny vessels in your eye. Whereas diabetes not exactly sure why. We'll get to that, I'm sure. What are some vitamins and antioxidants that are beneficial to your vision? Lutein, zeaxanthin, vitamin A. That appears to be it. So if you don't remember the names and you just gotta ask about foods, your reds and your greens. Mainly your greens will do it. Or oranges, because of the vitamin A with carrots. Alrighty. Danger signals of eye disease. So things that you can teach somebody to look out for if they may suspect injury to the eye. Persistent redness, continuing pain, vision is disturbed, changes in vision, whether that's colored flashes or a curtain is being drawn over your eye. If you have crossing of the eyes, if you have any unusual growths or any growths that are on your eye or around your eye, continuing discharge, crustiness, or tearing of the eye, and if your pupils are unequal, because, that's a bad sign in general. If you were to go to the eye clinic doing eye exams, what thing would you see the most often to check for pressure? The tono pin. This pin is neat, and you bounce it against the eye, and it just checks the interocular pressure of a person's eyeball. So apparently the reason why diabetes plays a role on your vision is that if you're constantly hyperglycemic, it can alter the shape of your lens and cause blurred vision, and it can also affect the blood vessels of the retina, causing bleeding. It doesn't go into the specifics of how, but that's what it does. Probably it will be discussed later. I am not going over these diagnostic tests at this time. So your abnormalities of lid position, ptosis, with myasthenia gravis, that's just your eyelids are drooping. So the entropin is when your eyelids are turned in. So in, and ectropin is your eyelid is turned outward. If that had an X, so it would mean exit, but it's ectro. But intro, inward. Blepharitis is the infection of glands and lash follicles along the lids. It's when your eyes are glued shut and you gotta put a warm compress on it. You got your chalazon and your hordelum. There are two different types of styes. The chalazon is internal, whereas the hordelum is the external. Conjunctivitis, or known as pink eye, is an inflammation of the conjunctiva sac. If you're dealing with that and you're putting medication on it, you got to make sure that, or eye drops or anything, you will go from in to out. So you'll start by the nose and you'll rub outwards towards your ear, or anything as such. And the purpose is that if you had extra so if you were putting eye drops in, if you put it up there and you had extra drops ooze out of your eye or something, it wouldn't contaminate the other eye. Let's see, we've covered vision impaired and eye drops and eye ointment. Eye drops in eye ointment. Okay, so now we're going on to the anatomy of the ear. You have 3 layers of your ear: the external, middle, and inner. Your external is the canal. The external in the middle is separated by your tympanic membrane. Your middle is dealing with your bones, the 3 little bones that are in there, and the oval window. And it also has the Eustachian tube, which is, I think, part of your sinuses that comes from the throat. The oval window is what separates the middle from the internal, and then your internal has your nerves, your cochlea, your vestibule, your semicircular canals, and that all deals with your balance. The biggest thing involving aging with the ear is not only do you lose hearing to a degree depending on the history you've had as a growing person, but also your earwax becomes harder and it contains less moisture, so it backs up easy. And then now on to the ear and ear problems. You have conductive and sensory hearing losses. Conductive, if you want to go to the bare basics, is dealing with how sound enters the ear. And it also is specific to just the external and middle ear. Whereas sensory is how the sound is interpreted. But it also is everything involving the inner ear. So, if you want to look at it that way, conductive is either conductive hearing loss is an interruption of how sound is moved through the ear, whereas sensory hearing loss is an interruption of how the sound is interpreted by the brain. And sensory is anything in the inner ear, so it can even deal with like Meniere's disease, which is an extreme sense of vertigo. Alrighty, and then you got ototoxic drugs. The most common first sign of ototoxicity is tinnitus. And those drugs that have ototoxic effects are antibiotics, mainly the ones that end in myosin, your loop diuretics, so anything that ends in mide pretty much, but your big one's going to be furosemide, aspirin, ibuprofen can do it. Okay. If you have to look in somebody's ear with an otoscope, you got to have the handle pointed upwards at an angle and make sure that the head mirror is positioned so that the central hole lies in front of one eye, so you can actually see into their eye. And at the same time, how do you pull the ear? Up and back. Good job. Alrighty, next thing. If you are going to irrigate an ear, how would you have the water? Wow, it depend. Are you doing a caloric test or not? Good question. You're not. So, what would you use? Warm water. Yes, you would use warm water. If you were doing a caloric test, what would you use? Cold water. Yes. And the cold water is what makes it actually have the response, which is nystagmus, vertigo, nausea, vomiting. And then with the warm water, it just helps. If it's from earwax buildup, it helps not only move the wax, but it also can melt the wax to a certain extent. Alrighty, so we've covered it a couple of different times, but if you are administering ear drops, how would you do it? To me, the biggest thing you would want to remember is after you've instilled the octic medication, keep the patient in a lateral position for 5 to 10 minutes so that it coats everything. And then I know enough about dizziness and vertigo because I get a lovely sense of motion sickness. And then tinnitus is ringing, buzzing, or continuous annoying noise. And then some drugs that can help with tinnitus are niacin, benzodiazepines, diazepam, chlordiazepoxide, and oral lipoflavonoid. And these drugs can also help with vertigo. And dun dun dun! We are done with chapter 26. Whoop whoop. Well, since we are done with that, we are going to do the extra review questions for 26, because why not? Okay, we shall begin the quiz. Question 1. A patient has a history of diabetes. The patient's medical record indicates the patient is non-compliant with both diet and medication to manage his condition. He has a history of prolonged periods of hyperglycemia. The patient's condition will most likely affect the muscles that constrict the retina, blood vessels of the retina, color of the conjunctiva, or functional ability of the lacrimal glands. It is the blood vessels. And I'm sure it'll give me a review at the end of this if I miss anything. A patient presenting with hearing loss is being evaluated to determine the type of loss being experienced. This most likely require which diagnostic test? If it's the type, it is going to be the odometry. That deals with type. During administration to the unit, a patient tells the nurse that he has blurred vision. Which diagnosis in his history may be related? Hypertension, asthma, angina, or osteoarthritis. Hypertension. The others don't make sense. A patient wearing corrective lenses has a visual acuity of 20/200. The nurse recognizes that this patient is legally blind. The nurse is performing a visual examination on a patient. During the examination, the patient is unable to see the letters on the chart. Which action by the nurse should be performed first? Notify the physician, check the patient's ability to count fingers, ask the patient to put on glasses, examine the patient using an ophthalmoscope. During the examination is unable to see the letters. What should you do first? See if they have glasses they can put on. The nurse is caring for a patient with a hearing disorder who has begun to complain of tinnitus. Which diagnostic test would be most appropriate? evoked response autometry, vestibular testing, autometric testing, or the Rene test. Which diagnostic test would be appropriate for tinnitus? I'm going to go with evoked response autometry just because the other one, another Rene's not it. I don't know. Which is a dangerous signal of eye disease? Continuous tearing of the eye, asymmetry in the color of the eye, increase in the size of the pupils when in a darkened room, blinking the eye more than 20 times in a minute. It is going to be the continuous tearing of the eyes. Sudden loss of vision is associated with which disorder? Retinal detachment, cataracts, glaucoma, or diabetic retinopathy. Sudden loss of vision. I remember reading about that. Did I just miss it because I thought I was smart? Well, it's, not in this chapter specifically. Sudden loss of vision. I'm going to go with retinal detachment. The patient is tested to determine intraocular pressure because it assists in diagnosing glaucoma. To best visualize the auditory canal of an adult. The auricle should be pulled. Oh, that's another name for Pina. Okay, then you're going to be up and back, up and back, up and back, up and back. A patient has been diagnosed with sensory neural hearing loss. The patient questions potential causes of this type of hearing loss, which are associated with a sensory neural hearing loss. Sensory. It is not. It's a select all that apply. It is not wax buildup. It's not a perforated eardrum. It can be meningitis. It is not osteosclerosis and exposure to loud noises. The nurse is reviewing a patient's chart. The nurse notes the patient's vision in his left eye is 20/70. This is best interpreted as the patient can see. I'm going to go with, your options are 20/70ths of what a normal-sighted person can see, 20/70ths of what a patient of that age can see, the line on the chart labeled 20 at 70 feet, or the line on the chart labeled 70 at 20 feet. That's the one I'm going to go with. A patient has a corneal abrasion. Which of these factors in the patient's history is most closely related to this problem? The patient wears contact lenses. The patient smokes. The patient is 75 years old. The patient has a history of renal disease. Contact lenses is your answer. The nurse is reviewing the assessment documentation on an assigned patient made the previous shift. Patient is reviewing the assessment okay. The nurse notes perla, which indicates that pupils are not appropriately reactive to light, not completely round, equal in size, teardrop shape, and react appropriately to light. Equal in size. For which condition would a myringotomy be appropriate? Rupture of the tympanic membrane, otorrhea, proboscis, or obstruction of the escutcheon tube. That one. A patient has a caloric test to check for alterations in vestibular function. The patient asks the nurse what the normal test findings will be. The LPN should explain to the patient that if the test is normal, the patient is likely to experience no response, tingling of the earlobes, flushing of the skin, nausea and vomiting. Nausea and vomiting. Signs and symptoms of an eye disorder include select all that apply. Flashing lights, diplopia, irises of differing colors, nystagmus, and tear production. Eye disorder, flashing lights, diplopia, and nystagmus. Symptoms. A 70-year-old man says to the LPN, "My eyes seem drier than they used to be." In addition to being sure that the patient has no other symptoms and suggests the patient see a physician, it is appropriate for the nurse to make which of these suggestions? Use commercial replacement tears in your eyes, irrigate your eyes twice a day, increase your intake of vitamin A, decrease your intake of sodium. I'm going to go with the replacement tears. A patient complains of tinnitus. Which factor present in the patient's history may be most closely related to the patient's complaint? The patient is slightly dehydrated from gastroenteritis. The patient takes zinc supplements. The patient takes large doses of aspirin. The patient is a high school student. Aspirin. I correctly answered 15 out of 19. Which ones did I get incorrect? Oh, okay. First one I missed. A patient with hearing loss is being evaluated to determine the type of loss being experienced. This would most likely require which diagnostic test? I answered with audiometry, which is incorrect. The correct test is the Rene test, and the reason is the Rene differentiates between sensory and conductive, whereas audiometry determines the degree of loss. Alrighty, the second. The nurse is performing a visual examination on a patient. During the examination, the patient is unable to see the letters on the chart. Which action by the nurse should be performed first? I answered with, ask the patient to put on glasses. The correct answer is you check the patient's ability to count fingers. And the rationale is the nurse needs to obtain as much information during the examination as possible. The nurse should hold up his or her fingers and ask the patient how many can be seen. Once information has been obtained, the physician should be notified. There is no indication given that the patient wears glasses. So my reaction was put on the glasses because he might have some. However, that's incorrect. Your first step is apparently to count fingers. Alrighty. Next one. The nurse is caring for a patient with a hearing disorder who has begun to complain of tinnitus. Which diagnostic test would be most appropriate? Yeah. I didn't think I would get this one right. I put evoked response audiometry, which was incorrect. Evoked response audiometry assesses the abnormality of nerve pathways between the brainstem and the 8th cranial nerve. The correct answer was vestibular testing. It says tinnitus or ringing in the ears is often a symptom of Meniere's disease. It may be associated with dysfunction of the vestibular system of the inner ear. So that's why you would do vestibular testing, apparently. Okay. Patient has been diagnosed with sensorineural hearing loss. The patient questions potential causes of this type of hearing loss, which are associated with a sensorineural hearing loss. It was a select all that apply. I put just meningitis and exposure to loud noises. Apparently, it also includes perforated eardrum, and osteosclerosis. I don't agree with that at all. Because it doesn't give an explanation, which makes me mad. Because perforated eardrum is connective, and so is autosclerosis. And it even says that in the book specifically on box 26-2 for me: conductive, autosclerosis, trauma and scarring of the tympanic membrane. I don't agree with that at all.